Hello guys, you're welcome back to my YouTube channel. So in this video, we'll simply be looking at the brachial plexus, the gross anatomy of the brachial plexus. So what do you understand by the word brachial plexus? The brachial plexus is simply a network of nerve that emerges from the root of the neck, then passes through the axilla to innervate the muscles of the upper limb and as well as the skin of the upper limb. Alright, so the brachial plexus is divided into 5 parts. Okay, so these parts include the root, the trunk, the divisions, the cord, and the branches. So an important mnemonic that you can use to remember these parts of the brachial plexus is read that them cadaver book. Read for the root, that for the trunk, them for the divisions, cadaver for the cord, and book for the branches. Okay, so these parts of these divisions of the parts of the brachial plexus it's not as if it has separate functions that they do. No, they don't have separate function. It's just that so that the brachial plexus can be described very well. Okay, so that is why we have these parts of the brachial plexus. So we'll be taking them one after the other. All right, so the first one, which is the root of the brachial plexus, the root of the brachial plexus is just formed by the anterior rami of the spinal nerve, which includes the C5, the C6, C7, C8, and T1. So it is this anterior rami of the spinal nerve that forms the root of the brachial plexus. Then for the trunks of the brachial plexus is formed. There are actually 3 trunks of the brachial plexus. All right. So you have the superior trunk, the middle trunk, and the inferior trunk, and it is named due to its anatomical position. All right. So for the superior trunk is formed by the combination of the C5 and C6 root gives rise to what? The superior trunk. Then for the middle trunk is just the continuation of the C7 root. Okay. Then for the inferior trunk is formed by what? The union of the C8 and T1 root. All right. Okay, so now let's move over to the divisions of the brachial plexus. After the formation of the brachial plexus, remember we say that the brachial plexus it starts from what? The root of the neck, and then it gets to the posterior triangle. Okay, then enter the axilla and then enter into the upper limb and supply the muscles of the upper limb. So after the formation of the root and then the trunk, then as the brachial plexus passes between the anterior rami, passes between the anterior scalene muscle and the medial scalene muscle to get to the posterior triangle. So at the posterior triangle, the trunks of the brachial plexus divides. All right, it divides into each of the trunk divides into 2. The first one is the anterior division, whereas the second one is the posterior division. All right, so the anterior division moves anterior to the it moves to the front of the neck, whereas the posterior division moves towards the back of the neck. Okay, so it simply means that we have 3 anterior divisions of the brachial plexus and 3 posterior divisions of the brachial plexus. All right, so the next part of the brachial plexus after the divisions is what? The cords of the brachial plexus. So there are 3 cords of the brachial plexus: the medial cord, the lateral cord, and the posterior cord, and they are named according to its position relative to the axillary artery. Okay, so for the lateral cord is formed by the anterior division of the superior trunk and the anterior division of the middle trunk. All right. Okay, these are the divisions that forms the lateral cord. Then for the posterior cord is formed by the posterior divisions of all the divisions of the brachial plexus. The three posterior divisions of the brachial plexus forms the posterior cord. That is the posterior division of the superior trunk, the posterior division of the middle trunk, and the posterior division of the inferior trunk forms what? The posterior cord of the brachial plexus. All right. Then for the medial cord, the medial cord is formed by the anterior division of the inferior trunk. Okay, that is for the trunks of the cords of the brachial plexus. Then for the branches, the brachial plexus, when it gets to the axilla, at the axilla and the superior part of the upper limb, it divides into 5 major branches of the brachial plexus. The 5 major branches of the brachial plexus includes the musculocutaneous nerve, the axillary nerve, the median nerve, the radial nerve, and the ulnar nerve. These are the 5 major branches of the brachial plexus. In this video, we'll simply be looking at them one after the other. Though we'll not go into details, we'll just talk about the nerve roots and the muscles they possibly supply. All right. So in our subsequent video, we'll be talking about, we'll be looking into them one after the other in details. Okay. So the musculocutaneous nerve. Let's pick the musculocutaneous nerve first. The musculocutaneous nerve is the nerve root of the musculocutaneous nerve is from C5, C6, and C7. All right. So these are the nerve roots of musculocutaneous nerve, and it innervates the coracobrachialis, the brachialis muscle, and the bicep brachii. Okay. So these are the muscles that the musculocutaneous nerve innervates. The next branch of the brachial plexus that we'll be looking at is the axillary nerve. The axillary nerve root is simply C5 and C6. Okay, the axillary nerve innervates the deltoid muscle and the teres minor muscle. All right. Okay, so also the sensory function of the axillary nerve is it gives off the superiolateral cutaneous nerve of the arm, and this superiolateral cutaneous nerve of the arm innervates the upper part of the lower part of the deltoid muscle. All right, and that part is known as the regimental bulge area. Okay, so the next branch of the brachial plexus that we'll be looking at is the medial nerve. Okay, the medial nerve root is from C6 to T1. Although in some individual there are some individual that has the nerve fiber of C5, but majorly it is C6 to T1. All right, that is for the medial nerve. And the medial nerve innervates the muscles of the anterior compartment of the forearm, the thenar muscles, and the 2 lateral umbilicals. Okay, so moving forward, the next branch of the brachial plexus is the radial nerve. Okay, the radial nerve root is C5 to T1. So it is the branch of the brachial plexus that has all the nerve roots of the brachial plexus, that is from C5 to T1. Okay, and this radial nerve innervates the triceps brachii muscle and the muscles of the posterior compartment of the forearm. All right, so the next branch of the brachial plexus that we'll be looking at is what? The ulnar nerve. Okay, the ulnar nerve root is just from C8 to T1. Okay, and ulnar nerve innervates the intrinsic muscles of the hand. All right, so apart from the thenar muscles and 2 lateral umbilicals, it also innervates the flexor carpi ulnaris muscle. Okay, so these are for the main branches of the brachial plexus. Although the brachial plexus also has minor branches. Okay, and these minor branches comes out from different parts of the brachial plexus. For the roots of the brachial plexus, you have the dorsal scapular nerve, and the long thoracic nerve. Okay, then for the trunk you have the suprascapular nerve and the nerve to the subclavius. Then for the lateral cord you have the lateral pectoral nerve. Then for the medial cord you have the medial pectoral nerve and have the medial cutaneous nerve of the arm and the medial cutaneous nerve of the forearm. Then for the posterior cord has the thoracodorsal nerve, then the superior subscapular nerve and the inferior subscapular nerve. So these are the minor branches of the brachial plexus. All right. So the next thing that we'll be looking at is the clinical correlate, the clinical significance of the brachial plexus. The major clinical correlates, we'll just be talking about the two clinical correlates. We have the injury to the upper root of the brachial plexus, which is known as the Erb's palsy. So when there is a damage to the C5 and C6 root, it results to Erb's palsy, and it majorly occurs during when there is difficulty in childbirth. Okay, when there is difficulty during childbirth, that is the arm of the baby is stretched during vaginal delivery, so it results to the damage of this nerve root C5 to C6, leading to Erb's palsy. Okay, so the manifestation of this Erb's palsy is known as the waiter's tip. Okay, the waiter's tip. Okay, so that is for the Erb's palsy. So the next clinical correlates that we'll be looking at is the Klumpke's palsy. The Klumpke's palsy is just an injury to the lower root of the brachial plexus. It leads the affected muscle in the affected nerves in this Klumpke's palsy is the medial nerve and the ulnar nerve. All right. Then for the Erb's palsy, the affected nerves are the musculocutaneous nerve, majorly the musculocutaneous nerve and the suprascapular nerve. Okay, these are the nerves that are affected, and when these nerves are affected, it simply means that the muscles that they supply is also going to be affected. Okay, so that is for the nerves that is being affected in Erb's palsy. Okay, then for Klumpke's palsy, the major nerves is the medial nerve and the ulnar nerve, and the manifestation is clawed finger. Okay, the finger becomes clawed. Okay, so that is that for the clinical colorate of the brachial plexus. Then for practical, during practical procedure, when you are dissecting the brachial plexus, okay, you are dissecting the upper limb to see the brachial plexus. It is always very difficult to see to know the brachial plexus, the part of the brachial plexus that you are, but you should always look out for the M structure. There is always an M structure that is being formed by the brachial plexus, and the nerves that forms that M structure is the musculocutaneous nerve, the medial nerve, and the ulnar nerve. Okay, so these are the nerves that forms the M structure. So it always lie superficial to the axillary artery. The axillary artery runs under it. That means the axillary artery lies deep to this M structure. Okay, so this M structure will help you to locate your bearing while doing your dissection, and as well it will help you to trace the different parts of the brachial plexus, like the cord, the roots, the branches, and the other parts of the brachial plexus. So thank you guys for your time. Thank you for watching this video. Thank you for sticking to this channel. Please subscribe to this YouTube channel. Subsequent videos, better videos, and more educative video will be coming in. Thank you, and God bless you. Remain focused, remain peaceful, and remain disciplined. God got you. Peace.